I'm Mark Ferguson. I'm a professor of surgery at the University of Chicago. And I was first appointed to the Annals editorial board in 2000, and I became an associate editor in 2005 and deputy editor in 2012, which is my current role. While I'm on the editorial board, I'd like to help in transforming the Annals to a journal that retains its quality and content, but is more approachable and more interactive. Becoming an author on a manuscript for the first time can be very challenging. If I were to give advice to such people, I'd say that you first have to identify a question that's important and that hasn't been answered yet, and then carefully design the experiment or study that will answer that question. Only then do you begin crafting the manuscript that will ultimately become an article. There are a few reasons that are fairly common as to why manuscripts get rejected. The first is that the study that they're reporting wasn't adequately designed to answer the question being asked. Another reason is that the question being asked isn't sufficiently important or has already been answered. And a third is that the data aren't sufficient to adequately address the question. There are a lot of exciting things happening in cardiothoracic surgery currently, but I'm most interested in the growth of robotics, both the application, but also the technology. The current technology of robotics is very basic, and there's a lot of room for improvement. I can see in about a decade from now that robotics will have transformed the practice of cardiothoracic surgery. The choice of subspecialty training is very difficult for many medical students, but for me, I always thought that I was going to be a surgeon. The only choice that I really had to make was the subspecialty training. Like a lot of people, my mentors were very important in that choice. So my first advisor was a cardiothoracic surgeon, my chairman was a cardiothoracic surgeon, and my favorite teachers in medical school were also cardiothoracic surgeons. I also found that the physiology and the anatomy of thoracic surgery in particular resonated well for me. Being a physician can be very rewarding. Being a thoracic surgeon in particular is especially rewarding because of the types of impacts that we can have on patients and their families. A lot of physicians can manage disease, but when you're an oncologic thoracic surgeon, you can actually cure cancer. And the way that this influences people's lives is quite remarkable. Balancing different responsibilities for my professional and private lives has been challenging, and I will be the first to admit that these things aren't in balance for me. I tend to spend more hours working than I do playing. I'm very fortunate to have an understanding wife who has a very independent life of her own and accepts the responsibilities and hours that I've committed to. Fortunately, when we have time together, we tend to enjoy it tremendously. So there are rewards in the private side, despite the sacrifices that I tend to make. Well, having time for hobbies has sometimes been difficult. I've trended through a series of hobbies in the past, including being a runner and cycler, and then horseback riding, and then scuba diving. My current hobby is gardening. It doesn't sound very interesting, I know, but within the last 2 years, we've planted a half-acre prairie garden. It takes a lot of our time, but also is tremendously rewarding at all seasons of the year. One thing that I would like to do, which I may never be able to do, is to play the piano at a professional level. I've been a pianist all of my life and come from a family of professional musicians. I've started to commit myself in the last few years to practicing diligently on some moderately difficult pieces with a goal in mind of playing it meaningfully and perfectly. And this still eludes me.